Good day to everyone. Anyway, I am Irving Homer L. Pimentel and I will be opening this lecture video about anti-Parkinsonism. So, anti-Parkinsonism agents are drugs used for the management of signs and symptoms of Parkinson's disease, which is a progressive, chronic neurological disorder primarily characterized by lack of coordination. Parkinson's disease is caused by degeneration of nerve cells in the part of the brain called the substantia nigra. Nerve cells in this part of the brain are responsible for producing a chemical called dopamine, which is essential in the coordination of neurotransmitters in accordance with movement. Hence, this drug has its important factor to regulate the production of cells needed by the brain. Specifically, anti-Parkinsonism agents will help in the process by replicating or mimicking the release or production of dopamine to support the action of these receptors towards the overall bodily functions. If not taken seriously, Parkinson's disease may progress in time that may develop rigidity and weakness of the body. Other symptoms may refer to as difficulty in walking and talking. They may also have mental and behavioral changes, sleep problems, depression, memory difficulties, and fatigue. Some major classification of anti-Parkinsonism agents introduce the use of drugs, including levodopa, dopamine receptor agonists, amantadine, and other receptor agents that is under anti-Parkinsonism. So next reporter, please.
So, uh, this is the pathophysiology of the Parkinson's disease based on the notes. So, although the cause of Parkinson's disease is not known, okay, so it is still identified that the signs and symptoms of the disease relate to damaged neurons in the basal ganglia of the brain. So, theories about the cause of degeneration of these neurons range from viral infection, blows to the head, brain infection, atherosclerosis, and exposure to certain drugs and environmental factors. Okay, so even though the actual cause is not known, the mechanism that causes the signs and symptoms of Parkinson's disease is understood. Okay, so our report will also discuss more about the specific actions of this agent that will be indicated as how anti-Parkinsonism work. We will also add the effects of the drugs towards the body as its pharmacokinetics. The briefing of some side effects or adverse effects of the drugs will also be tackled. Moreover, the contradictions in the food or drug interactions will also be added until the nursing consideration as our solution action towards the disease is stated. Overall, the report will focus on the drug anti-Parkinsonism. In a part of the brain called the substantia nigra, a dopamine-rich area, nerve cell bodies begin to degenerate. This process results in a reduction of the number of impulses sent to the corpus striatum in the basal ganglia. This area of the brain, in conjunction with the substantia nigra, helps to maintain muscle tone not related to any particular movement. The corpus striatum is connected to the substantia nigra by a series of neurons that use gamma-aminobutyric acid, or GABA, an inhibitory neurotransmitter. The substantia nigra sends nerve impulses back into the corpus stratum using the inhibitory neurotransmitter dopamine. The two areas then mutually inhibit activity in a balanced manner. Higher neurons originating in the cerebral cortex secrete acetylcholine, an excitatory neurotransmitter, in the area of the corpus striatum to coordinate intentional movements of the body. So when dopamine decreases in the area, a chemical imbalance occurs that allows the cholinergic or excitatory cells to dominate. This affects the functioning of the basal ganglia and of the cortical and cerebellar components of the extrapyramidal motor system. The extrapyramidal system is one that provides coordination for unconscious muscle movements, including those that control position, posture, and movement. The result of this imbalance in the motor system is apparent as the manifestation of Parkinson's disease.
Okay, so let's now proceed to the mechanism of action of the antiparkinsonism drug. It says here that it has been found to trigger the release of dopamine from neurons in the brain. It also blocks excretatory signaling and neural overactivity associated with movement. It has some side effects such as confusion, dizziness, nausea, and vomiting are listed among its side effects. For the indication of the drug, it is used to treat the signs and symptoms of Parkinson's disease, but it only treats and manages the symptoms, but it does not treat the disease itself. So overall, the mechanism of action of anti-Parkinsonism drug, it releases dopamine to control the neural activity or the overactivity associated with movement of a patient. So for example, your patient has some wiggling of his hand, and then he experiences the involuntary movement, and then that's when you know that the patient has Parkinson's disease. Now, the release of dopamine will manage and control that uncontrollable movement. It makes the patient more calm. The patient's body will be calm and managed. So that is the mechanism of action of the anti-Parkinsonism drug and the indication and what does it treat. So next reporter, please.
So what is the pharmacokinetics of your anti-Parkinsonism? It is rapidly absorbed after your PO administration. The protein binding is 99%. It is metabolized in the liver. It is eliminated primarily in urine, which is 60%, and to a lesser extent in feces, which is 40%. It is unknown if removed by hemodialysis, and the half-life is 2 to 3 hours.
The side effects or adverse effects of anti-Parkinsonism agents are the following. Frequent or the common ones are nausea, insomnia, somnolence, or sleepiness, or feeling drowsy. Anorexia is a eating disorder that is characterized by a intense fear of gaining weight or a distorted perception of weight. Next is diarrhea. We may also feel muscle cramps, orthostatic hypotension, or in which our blood drops quickly when we stand up from sitting or lying. Excessive dreaming and dry mouth. The occasional side effects or adverse effects are headache, vomiting, confusion, hallucinations, constipations, diaphoresis or the excessive sweating. We may also have bright yellow urine, dry eyes, abdominal pain, dizziness, and flatulence. The rare side effects or adverse effects are dyspepsia or the pain that occurs in our upper abdomen, neck pain, hypotension, fatigue, and chest discomfort.
So next are the contraindications and cautions in using the anti-Parkinsonism. For dopaminergic agents, the following are contraindications and cautions that we should all be reminded. For the dopaminergics, these are contraindicated in the presence of any known allergy to the drug or drug components to prevent hypersensitivity reactions, which would not normally trigger an immune response, and in angle closure glaucoma, which could be exacerbated by these drugs or it would even make it worse. Dopaminergics enter breast milk and should not be used during lactation because of the potential for adverse effects in the baby, like irregular heartbeat and shortness of breath. For pregnancy, if a pregnant mother takes this drug, it can enter the placenta and could adversely affect the fetus. It may even cause damage, and abnormal development leading to birth defects. So, care is very necessary during pregnancy and in patients with renal and hepatic disease because it could interfere with the metabolism and excretion of the drug. In addition, levodopa is contraindicated in patients with a history or presence of suspicious skin lesions because this drug has been associated with the development of melanoma. In administering the dopaminergic agents, it should be used cautiously with patients who have any condition that could be exacerbated by dopamine receptor stimulation, such as cardiovascular disease. For the cardiovascular disease, it includes myocardial infarction, arrhythmias, and hypertension. It also includes bronchial asthma, history of peptic ulcers, urinary tract obstruction, and psychiatric disorders. For those who have hepatorenal diseases, this drug can interfere with metabolism, which makes excretion of the drug more difficult. So, closely monitor cardiac status in patients receiving apomorphine it, because of the associated risk for hypotension and prolonged QT interval. For the anticholinergic agents, anticholinergics are contraindicated in the presence of allergy to any of these drugs to avoid hypersensitivity reactions. So it is the same with the dopaminergic agents as it can cause hypersensitivity reactions. In addition, they are contraindicated in narrow angle glaucoma, gastrointestinal obstruction, and gen- genitourinary obstruction, including the prostatic hypertrophy, as all of which could be exacerbated by the peripheral anticholinergic effects of these drugs. And in myasthenia gravis, which could be exacerbated by the blocking of acetylcholine receptor sites at neuromuscular synapses. The safety and efficacy for use in children have also not been established. In administering these agents, it should cautiously be done in the following conditions: the tachycardia and other dysrhythmias, and hypertension or hypotension, because the blocking of the parasympathetic system may cause a dominance of sympathetic stimulatory activity and hepatic dysfunction. It could interfere with the metabolism of the drugs and lead to toxic levels. In pregnancy, they should be used during pregnancy and lactation only if the benefit of the mother clearly outweighs the potential risk to the fetus or neonate. So it is always reiterated that the use of drugs in pregnancy it is only used if the um, potential risk, if the benefit outweighs the potential risk to the fetus or neonate. In addition, use caution in individuals who work in hot environments because reflex sweating may be blocked, placing the individuals at risk for heat prostration.
So let's move to the nursing consideration about the anti-Parkinson's disease. Next slide. Nursing consideration for patient receiving dopaminergic agents, assessment or the history and examination, assist for mentioned mentioned contraindication and caution for the drug allergy, GI depression, or obstruction, DPH, glaucoma, or to prevent untoward complications. Next is perform a thorough physical assessment for CNS, respiratory status, vital signs, CV status, vowel sounds, and urine output. To obtain the baseline data, determine drug therapy effectiveness, and monitor adverse effect. Next is assist for skin for suspicious lesions if levodopa is to be given because it can be cause of exacerbate melanoma. Next is assist for history of prolonged QT interval and obtain electrocardiogram if apomorphine is to be given to prevent further prolonged QT interval and serious time gas. Next. Next is assess level of orientation and neurological status, including affect, reflexes, and bilateral grip strength, gait, tremors, and spasticity to evaluate any central nervous system effects. Then auscultate lungs and assess respiratory status to evaluate for changes that could be exacerbated by the drug's effect. Monitor pulse, blood pressure, and cardiac output to evaluate for possible adverse effect. Next is auscultate the bowel sounds to evaluate GI motility to assess for adverse effect. Assess urine output and palpate bladder to determine adequate bladder and renal function. Next is monitor the laboratory test results, which is the liver and renal function, and CBC, to determine the need for possible dose adjustment or evaluation of possible bone next. So next is we're going to discuss about the nursing diagnosis. The nursing diagnosis related to drug therapy might include the following: disturbed thought process related to CNS effect, risk for urinary retention related to dopaminergic effects, dopaminergic effects, and constipation related to dopaminergic effects, risk for injury related to CNS effects and incident for osteostatic hypertension, and deficient knowledge regarding drug therapy. Next slide. Next slide. We have also the implementation with rational, decrease dose or discontinue the drug if dry mouth becomes so severe that swallowing becomes difficult. So continue, give drug with caution and arrange for a decrease in dose in hot weather or with exposure to hot environments because patients are at increased risk for heat prostration because of decreased ability to sweat. Next is forgive drug with meals if GI upset is a problem before meals. If dry mouth is a problem and after meal is for drooling occurs and the drug causes nausea to facilitate compliance with the drug therapy. Next for the monitor bowel function and institute a bowel program if constipation is severe. Next is ensure that the patient voids before taking the drug. Monitor urinary output and palpate for bladder distension and residual urine if urinary retention is a problem. Next is to establish safety precaution if CNS or vision changes occur to prevent patient injury. Next slide. Next is perform physical assessment to determine the Vaseline data for determining the effectiveness of the drug and the occurrence of adverse effect associated with the drug therapy. Next is for assess level of orientation and neurological status, including affect, reflexes, bilateral grip, strength, gait, and tremors and spasticity to evaluate any central nervous system. Next slide. Next slide. Provide thorough patient teaching about topics such as the drug name and the prescribed dose, measures to help avoid adverse effects, warning signs that may indicate problems, and the need for periodic monitoring and evaluation to enhance patient knowledge about the drug therapy and to promote compliance. Next is to offer support and encouragement to help the patient cope with the progressive nature of the disease and long-term drug regimen.
So we're going to go to evaluation, monitor patient response to the drug, improvement signs and symptoms of Parkinson's disease, monitor for adverse effects, the CNS changes, urinary retention, GI depression, tachycardia, increased sweating, and flushing. Evaluate the effectiveness of the teaching plan, which is patient can give the drug name and dosage, name possible adverse effects to watch for, and specific measures to prevent them, and discuss the importance of continued follow-up. Next is monitor the effectiveness of support measures and compliance with the regimen. Next. The key points: dopaminergic drugs are used to increase the effects of dopamine at receptor sites, restoring the balance of neurotransmitters in the basal ganglia. The adverse effects associated with these drugs are related to the systematic effects of dopamine, increased key points, heart rate, increased blood pressure, decreased GI activity, and urinary retention. Levodopa is the standard dopaminergic used to treat Parkinsonism and Parkinson's disease. Several other dopaminergics are now used as adjuncts to levodopa to increase the dopamine effects as long as possible. Next.
The nursing considerations for patients receiving anticholinergic agents. So for the assessment, history, and examination, assess for contraindications or cautions, any known allergics to these drugs to avoid hypersensitivity reactions, gastrointestinal or GI, depression or obstruction, urinary hesitancy or obstruction, benign, prostatic hypertrophy, glaucoma, myasthenia gravis to prevent untoward complications. Next one is perform a physical assessment to determine baseline data for determining the effects of the drug and the occurrence of adverse effects associated with drug therapy. Next one is assess level of orientation and neurological status, including the affect reflexes, bilateral grip, strength, gait, tremors, and spasticity to evaluate any nervous system effects. Also monitor pulse, blood pressure, and cardiac output to evaluate for possible adverse effects related to blocking of suppressive actions on the heart. We should also auscultate bowel sounds to evaluate the GI motility and detect possible indications of paralytic ileus. Also assess urine output and palpate bladder to determine adequate renal and bladder function. Monitor the results of laboratory tests such as the renal and liver function tests to determine the need for possible dose adjustment and identify potential toxic effects. Next one is the nursing diagnosis related to drug therapy might include the following. Impaired oral mucous membranes related to anticholinergic effects, risk for impaired thermoregulation related to anticholinergic effects, impaired urinary elimination related to genitourinary effects, constipation related to GI effects, disturbed thought process related to CNS effects, risk for injury related to CNS effects, and deficient knowledge regarding drug therapy. So the implementations with rationale, arrange the decreased dose or discontinue the drug if dry mouth becomes so severe that swallowing becomes difficult. Provide sugarless lozenge to soak and frequent mouth care to help with this problem. We should give drug with caution and arrange for decrease in dose in hot weather or with exposure to hot environments because patients are increased risk for heat frustration because of decreased ability to sweat. Give drug with meals to alleviate irritation if present. Monitor bowel function and institute bowel program if constipation is severe. Ensure that the patient voids before taking the drug. Monitor urinary output and palpate for bladder distension and residual urine if urinary retention is problem. Provide safety measures. Example is the adequate lining and raised side rails to prevent patient injuries. Provide thorough patient teaching about topics such as the drug name and prescribed dose, measures to help avoid adverse effect, warning signs that may indicate problems, and the need for periodic monitoring and evaluation to enhance patient knowledge about drug therapy and to promote compliance. Offer support and encouragement to help the patient cope with progressive nature of the disease and long-term drug regimen.
Evaluation, monitor patient response to the drug, improvement in signs and symptoms of Parkinson's disease or Parkinsonism, monitor for adverse effects, CNS changes, urinary retention, GI slowing, tachycardia, decreased sweating, flushing. Evaluate the effectiveness of the teaching plan. Patient can give the drug name and dosage, name possible adverse effects to watch for and specific measures to prevent them, and discuss the importance of continued follow-up. Monitor the effectiveness of support measures and compliance with the regimen. Next. Anticholinergic agents are used to suppress the stimulatory effects of acetylcholine in the substantia nigra, bringing balance into the control of movement. The adverse effects associated with the anticholinergic drugs are related to blocking of the acetylcholine in the parasympathetic nervous system, dry mouth, constipation, urinary retention, increased heart rate, and decreased sweating.
Okay, so that's it for our anti-Parkinsonism drug reports. It is discussed very well about the function, about the mechanism of action, indications, introductions, effects, implementations, considerations for nurses, and every bit of details that we need for anti-Parkinsonism drug. Thank you.